Hey there, you're welcome to the CSEA podcast. CSEA is an independent non-profit research organization that conducts evidence-based research for effective policymaking in Africa. In this podcast series, our guests will provide in-depth analysis, discuss policy implications, and suggest potential solutions on key development issues such as education, climate, energy, data governance, health, and food security. My name is Abe Michael, and I am your host. On this episode, we have Fidelis Obani, who is a researcher here at Center for the Study of the Economies of Africa. Hello, Fidelis. How are you doing?
Hello, Ave. Thank you for having me.
Good to have you here.
It's a pleasure.
Yes. So we have World Cancer Day coming up. Quite an interesting holiday to mark. And I'm not sure, are you aware of the theme for Cancer Day?
Of course.
Yes. So tell us the theme.
Okay. The theme is close the care gap.
Yes, close the care gap. What do you understand by close the care gap?
Yeah, before delving into that, I think it's very essential because this day is a very important one. That's World Cancer Day. I would say it's a global day of reflection and action because cancer, as we know, is a public health menace. And we have different types of cancers. We have lung cancers, pharyngeal cancers, etc. These types of diseases are something that are caused by human actions or something attributable to human actions, such as maybe smoking, bush burning, etc. Most especially, we'll be focusing on tobacco consumption as one of the leading cause of, lung cancer and other types of cancer. So, caregiving is very important because most of these diseases caused by tobacco smoking cannot be managed by smokers alone.
Yeah.
In the light of this, they require treatment by specialized healthcare providers such as lung specialists, cardiologists, and even informal caregiver. So caregiving is very essential to be able to manage something like lung cancer, pharyngeal cancer, etc.
Yes, that's. Thank you for just setting the tone right. You know, for global impact, cancer is actually a leading cause of deaths worldwide. It's responsible for millions of deaths each year. And efforts to raise awareness and promote early detection and treatment are very crucial in the fight against cancer. Before we move forward, it's very important to state some of the facts that are associated with cancer. In 2020, an estimated 19.3 million new cancer cases were diagnosed globally. In the same year, there were approximately 10 million cancer-related deaths worldwide. And the most types of cancer include lung, breast, prostate, stomach, and liver cancer. Cancer is one of the leading causes of death worldwide, accounting for nearly 10 million deaths annually. So in the publication, which is also available on our websites, The Caregiver's Burden, you see how caregivers are affected, even trying to get people well. What do you think is a solution to protect the caregivers as well?
Yeah, thank you for that important question. As we all know, caregiving is something very difficult as well. It's a task that is very essential for recovery process and to improve our patients' overall well-being because it reduces productivity, it causes trauma, leads to anxiety, not only on the part of the patients, but also the caregivers. So I would say it is essential for us to have a more coordinated measures, especially in the area of Empower framework for proper coordination. Empower framework is a framework developed by the WHO to manage or to control tobacco consumption. So I would say it is also essential for us to encourage interventions around tobacco use, cessation, reduction in secondhand smoking, etc. They are very necessary for us to be able to jointly combat the deleterious impact of tobacco use in our society, which often cause lung cancer, pharyngeal cancer, and other types of cancer.
Yes, thank you very much. For those who might be wondering what the caregiver's burden is, it'll just be good to put in perspective. It's the result of the physical, social, economic, and psychological effects of providing care on the lives as seen by them. So, Fidelis, thank you for also mentioning the Empower framework. I think that's very important, especially with the work that we do here at CSEA. I would also want to know, where are we with the solution for the caregivers? Because we have people that are sick, we have caregivers as well. And if there is a caregiver's body, it almost looks like a cycle because these are people trying to get people that are sick well. So if they are sick as well, that means there are people that are sick helping people to get well. They would still get sick. It's a funny circle, really. So where are we exactly with, just reducing caregivers' burden in Nigeria?
Okay, I think basically in the area of because if you are looking at Empower framework, one of the components is taxation reduction. There's one of the recommendations there that government should increase taxation rather in order to curb or to reduce demand for tobacco use. Another component of this Empower framework is offer help, which is about cessation. We have a lot of smokers who are willing to, quit this act or to reduce this act, but they couldn't find help. So it's part of what is very necessary for us to be able to, reduce this social cost of tobacco consumption, which is about, caregiving. So if a smoker can receive help even before getting to the extent of, having all these diseases like lung cancer, etc., the multiply effect of which is going to be affecting the caregiver in terms of burden of, rendering physical, psychological, and, support to the patient. So if they can get help initially before this disease manifests in their body, I think it's something that will really reduce caregivers' burden in Nigeria, which I think we can, put more effort in order to jointly combat this disease.
Yes, thank you. Well said. Is there any economic impacts? The caregivers' burden, does it have any economic impacts?
Of course, part of implication of caregiving in terms of burden is productivity reduction. A patient who suffer from lung cancer or pharyngeal cancer is not productive in the economy. So also a caregiver. According to the recent reports of our research that we jointly did with IECS, we discovered that the cost of informal care is 57,921,000 naira annually in Nigeria. And for the loss of productivity, we discovered that approximately it costs us in Nigeria around 79 million annually, which is something preventable if a smoker is willing and have access to, help, cessation, and policies, that can, really curb the demand for this product or the use of this product in our society. Thank you.
All right. Thank you so much. So we have a publication on our website on the caregiver's body. The conversation does not stop here. As a matter of fact, it has only just started. And also, let's just be aware, keep ourselves abreast with the information, and work together in the right direction to reducing the caregiver's burden. Fidelis, it was an absolute pleasure having you around. Thank you so much. And to all our listeners, thank you for listening. Do not forget to subscribe if you have not. Put on your post notifications for when we have new episodes. Have a lovely day.
Thank you for having me, Harvey.